When we started work on this programme, back soon after the 2010 election, we realised that this was a turning point in many ways in social policy. There had been the big effects of the biggest economic recession since the war, the Second World War, and a new government elected with very different policies from its predecessors.
We had just come through a period where there had been a lot of investment in many different types of policies, and many of them were shown to be effective and to be making a difference. The investment in education, in health, a whole lot of new policies for young children, the tax credit system, which had had an impact in terms of reducing child poverty.
You've got what we've described as a very warm climate for social policy making. You've got 10 years of economic growth, you've got an electorate that's broadly supportive of increased social spending. And then suddenly we get the biggest recession since the 1930s.
Things were going to change. Were these things going to be protected, probably just when you need them most, or were these things going to be unravelled?
This book is the latest actually in a series of work that we've carried out in CASE. We chart what's happened to health, adult social care, education, housing and area regeneration, communities policy, employment and taxation and social security. Goals of social policy over that period, inputs and outputs to different services, so how many teachers, how many nurses, how many hours of social care were in fact provided, and then look at the outcomes. The effect on poverty, on disadvantage of different forms, social mobility, on inequality, the gap between rich and poor, but also more generally inequalities between men and women, different age groups, disabled and non-disabled people. What were the consequences of the spending and policy decisions that were made for disadvantaged groups in the population?
The Coalition pledged to increase health in real terms every year of the Parliament, and the health system was protected in cash terms, but it wasn't protected relative to need and demand. We saw pressure on waiting times in accident and emergency, waiting times for hospital treatment, cancer treatment, diagnostics, patient experience of GP surgeries, out of hours, mental health services, and also public satisfaction with the NHS. We saw adverse trends in suicide and mental health, and that disproportionately affected the poorest households.
Our chapter on adult social care paints quite a bleak picture. By 2014-15, there was a fall of about 10% in spending, about 28% decline in those accessing community-based services, and the provision of unpaid care by family and friends was on the rise.
Children under 5 took probably a bigger hit from austerity measures than any other group. Sure Start experienced a 40% cut. You see big cuts to services delivered by local authorities, many of which are services aimed at young children, so childcare, early education.
The big story in higher education is there's been a precipitous fall in the numbers of both part-time and mature students. The number of part-time students has dropped by nearly a half. Overall, an enormous amount of reform and not much progress on the desired outcomes if you're coming from a poverty and inequality perspective. Since the crisis, we've seen a re-emergence of the north-south divide, the increasing dominance, economic dominance of London and the north falling behind. London has started to pull ahead of the other regions in terms of school achievements. Health and education outcomes have also started to diverge, so things like life expectancy and rates of death from the major diseases. We're also seeing increasing inequality within London.
And
important difference with the recent recession after the financial crisis and previous recessions was there wasn't any large-scale industrial restructuring. And the important thing about that is it meant that older workers didn't lose their jobs. We tend to think that the hit comes in terms of number of hours of work. This time it came in terms of cuts in wages right across the wage distribution. One of the other really significant things was the rise in self-employment, but a lot of that self-employment was very precarious, very low paid, and also there was the rise of 0 hours contracts, so other forms of very precarious work and increases in low wage employment.
The real change of gear when the coalition came into office was that they started cutting back on benefits and tax credits related to children, while spending on pensioner benefits, on the state pension, but other benefits and pensions as well, kept on growing. But to start with, benefits carried on being protected against inflation. There was, over the period as a whole, a very large tax giveaway that had to be paid for. It was paid for partly from cutting welfare for people of working age and partly through cuts in public services.
Two events here, the launch of 2 books, both published by Policy Press.
I think the big picture is that if you come to this thinking that it's going to be an overall picture of austerity, with everything being cut back in a uniform way, that's not what happened. Some services were more protected than others, and particular groups were affected more than others. People above pension age, relatively favoured, and people, younger people in their 20s and early 30s who were very hard hit.
This book is the most important book that comes out in social policy because it's part of a long-run series that always asks the same questions about how are we doing right across the whole social spectrum. This is the total, definitive, best you're ever going to get social policy audit.
I like having the facts with which to garner the arguments.
The importance of work like this is it makes sensible commentary on what's happening to the welfare state possible.
That picture of increasing inequality in incomes and in wealth and increasing damage to the life chances of the most vulnerable groups is the reality.